driven, and we function and practice on evidence, and we build upon evidence, and we develop new areas of inquiry and move forward with those. And looking at revenue and looking at just consumer-driven functionality with the average consumer in the past 3 years has generated, I believe, Susan, about $33 billion worth of revenue from the standpoint of utilizing integrative modalities outside of the medical realm. So we're looking at an opportunity missed, I think, by major healthcare organizations to not look at bringing in the fold of understanding what integrative healthcare is. Not changing minds, not changing direction of many practitioners' focus of practice, but helping them to understand what modalities may be used, how they may be functional and applicable to their patients, and where they may not be, so they can adequately educate and guide their patients to choose the right therapies.
Susan, I know you would like to join the conversation.
Well, I think that it's interesting that $33 billion is being spent out of pocket in the private sector. I think when Eisenberg did his early studies at Harvard back in the early 90s, I think it was $13 billion. So we could see the escalation of consumer-driven therapies, and I think we have to ask the question why. And again, this is probably going to drive a lot of the integration of new modalities. And I would like to comment that I think that part of what, as a practitioner, my experience has been, and in the literature, is that people really want to be listened to. They want to have a relationship with their practitioner. They want to feel that somebody is caring about them. And sometimes the question is it the modality, or is it the entire experience that's really lowering the stress response and having people start to make some behavioral changes? So I think that the potential for really, again, looking at both research and also asking the question of what is it that the population really wants in terms of a new paradigm. And we can really meet those needs if we're going to provide quality health care.
And I'd like to just ask another question of you to respond to. We're here at the School of Nursing and Health Studies. What do you see are some of the opportunities for nursing and other healthcare roles?
Thank you for asking that question. In December 30th in the New England Journal of Medicine, there was actually a really important article which was on nursing leadership in looking at chronic conditions. I think that the statistics are that by the year 2020, if we don't move toward wellness and prevention, we are looking at over $3.35 trillion. I'm not sure what that even means, but that is in healthcare costs if we continue on the trajectory of having half of the population be diabetic or pre-diabetic by 2020. And I want to say this is a global condition. If you look at the Middle East, if you look at Latin America, they are reflecting the same statistics based on industrialization and modernization and the fast food market and everything that goes along with that. So the opportunity for nurses who work in every sector of community, in hospitals and institutions, in private sector, to be able to be part of this is really exciting. Little statistic, there are 15 million nurses in the world, and it said that they care for 80% of the world's healthcare needs. That's astounding. In this country, there's 3.4 million nurses, and it's time, and I think that the IOM report really has moved nursing another level, getting back maybe even to the roots of nursing, which is really to be part of the solution and really utilize the skills of nursing in a new way.
That's good. And Maria, I know we're in active conversation here at the University of Miami. Can you share with us what you've heard and what the position of the university is in this very exciting area?
Yes, I will. Let me remember. The Dean of the University of Miami Middle School of Medicine, Dr. Goldsmith, Assistant Dean for Complementary and Integrative Medicine. She's with us today. Her name is Janet Knopfel. And at this, recently, a steering committee was formed with doctors and researchers committed to the integrative healthcare. This includes the members from 12 different departments. Also now in April, the Miller School of Medicine is having 2 conferences on integrative healthcare. One is a symposium, which is led by Janet Knopfel on integrative medicine and all the modalities available. And another one is later on in April, which I believe you do have a flyer that explains that it's Audrey Weil is going to be the key speaker, and it exposes how the university is on a leadership role at the moment. Also, there's going to be a course starting now in February where it's a meta-energetics, and you have that flyer too, so you can read what it's all about. And I think with all this going on and all this said, I do think the University of Miami is very strongly positioned in moving integrative healthcare forward.
That's great, thank you for that. And would you care to share with us what has brought you here to this point, and your story, and how you feel that it's been a tremendous benefit to you?
Okay, back in my teens, I had a very, very bad car accident that it was nearly fatal. I did have some physical problems to deal with. I had to nurse myself back to health. With the Western therapies, but also the Eastern modalities like meditation, Tai Chi, and those things restored not my physical health, but yes, my emotional health. And once I got it focused and I got well within my feelings, everything else started to flow perfectly. Along the way, I started searching. My curiosity began to try to understand how these things, which are so subtle and so not tangible, can really help a human being feel good. So I started reading and taking classes and going to seminars and on and on and on, but still it was only theory until one day I had a really bad neck ache and it was terrible. I went to see many, many doctors and nobody could figure out what it was, so they sent me this little pill so that it could relax me because it was stress induced. Of course, it didn't help much, so I decided to go and see an acupuncturist. I had 2 full body treatments, front and back. By the way, the first time that I had it, I was freaking out. So after 2 treatments, my pain was gone, and that was 15 years ago. It never came back. And another time I had a knee surgery. That was 5 years ago. I had a knee surgery, and my pain after 5 years of my knee surgery, it came back. So the doctor said, I think we have to redo it. I think we have to go in, do a laparoscopy, and find out what is going on. And I said, okay, fine, I'll call you back and I'll make an appointment. So I went straight to the acupuncturist and I said, get rid of the pain. And I had 2 treatments and it got rid of the pain. Now, people might ask, how does it work? I mean, the body is an energy system, which it's a biofield medicine, is the energy, it deals with the energy, how to balance your energy in your body. When you have that, any Western modality that you do have done to you will work 120%. Because your mind is set on making it work. That's my personal experience with integrative healthcare. And it is a very powerful thing to work in conjunction with Western modalities.
If I can pick up on what
Absolutely.
Maria had started to talk about, and I think is very important and be amiss not to mention, is how we could look at curriculum design for healthcare providers and making sure that their understanding in terms of curriculum design and how courses are offered and courses are taught to students in healthcare, that we could look at integrating ideas with integrated healthcare and becoming functional and moving forward with integrated healthcare, as they said, the model in how healthcare is practiced. Leave integrative aside, let's just practice it as it is with that integrative mindset and how we could incorporate these things within curriculum. I think that's very important. I think that's how one of the biggest, I think, impacts we could have in education and healthcare is to redesign or at least enhance what we're offering at the educational level and move it forward. And I'm talking from the generalist, bachelor's level, master's, practitioner, doctoral level. I think we need to lead it through curricula as it from the outset through the combination. And we're always learning, so there shouldn't be a combination, but I think we should continue to do that and move on forward.
I forgot to mention also how the physician in nursing home is so strong that Dr. Ambrosio had a curriculum approved this last spring on a postgraduate certificate program on integrated healthcare. Right now it's in the beginning stages. We're pending funds, so if anybody is interested to support the cost, feel free to talk to me afterwards, and I will certainly help. It will be a great help.
That's great. We're going to open it up to the audience to see if you have any questions. So if you would just, be recognized, speak respectfully, and address your comments to the panel. That would be great. Anybody have? Yes. Oh, can we have a microphone? We'll try to get a mic over here. Second row.
I have a question for anyone. I'm an internist practicing primary care, and I find a little bit of frustration when I recommend modalities to patients and they learn that it's not paid for by insurance. So there's an issue emotionally with patients where they believe, oh, this sounds good. So for example, I like a lot of my patients to do food sensitivity testing because I think it really can help me guide very rapidly into what they need to do. And they say, well, does insurance pay for it? No, and suddenly they think that it's not of value because insurance doesn't think it's of value.
That is a major thing to with Susan. Because I know, Susan, you've been practicing, so you might have found a way to work with this.
I think it's very challenging. And I think the current climate is that there are very few insurance companies that will cover the cost for integrative modalities. But I also think that's going to change because if you even look at the healthcare providers, the health insurance companies who have done their own wellness programs within their corporate structure, and they have seen the cost savings. I mean, there's a lot of reports as well as evidence-based research now coming out. So if the goal is for wellness as our healthcare priority and the healthcare industry, it seems to me that they would want to save money. I could be wrong, but I think if they're interested in saving money, it will be to invest in prevention and in offering these modalities. And I think there are consortiums now forming to work with insurance industry to try to move this forward, and maybe with the new healthcare priorities that are going on a national level,